Hello, my name is Caitlyn McCarthy, and I'm going to be speaking today about physical therapy interventions for patients with a stroke in inpatient rehabilitation facilities. To begin, what is a stroke? A stroke can be defined as blood supply to your brain is interrupted or reduced, which leads to brain tissue deprivation of oxygen and nutrition. Some signs of a stroke can be trouble speaking or seeing, paralysis of an extremity or face, headache, or trouble walking. The purpose of this study was to describe physical therapy provided to patients with a stroke that were in an inpatient facility. Before this study was done, there was little evidence describing interventions for patients with deficits from a stroke. This study took place March of 2001 through August of 2003. During this study, 972 patients received inpatient physical therapy post-stroke with a mean age of about 66. There were a variety of nationalities used during this study, and also 43% had left-sided hemiplegia, 44% had right-sided hemiplegia, 10% were bilateral, and 3% had other deficits. 6 inpatient rehabilitation facilities were used during this study, which included Northern California, Southern California, Oregon, Utah, Pennsylvania, and Washington, D.C. Care was provided from 86 physical therapist assistants, aides, and students. During the procedure, one therapist from each site went through a train-the-trainer session with the project team. During this session, they developed definitions for the data collection forms, and they also created a manual with the interventions to take back to each site for the clinicians that would be treating. Some of the interventions included proprioceptive neuromuscular facilitation, neurodevelopmental treatment, general theoretical approaches, and there was also a broad range of other interventions which included modalities, pet therapy, neuromuscular, musculoskeletal, cardiopulmonary, cognitive perception, and education. Also, 27 different types of equipment was used. Now on your screen you see part of the data collection form that was used during this study. There was categories of treatment. There was also time spent with the patient. They had to list who worked with the patient that day and the time spent evaluating and examining the patient. They were also able to pick 5 out of the 59 specific interventions for each activity. Some activities included pre-functional, bed mobility, sitting transfers, sit-to-stand transfers, wheelchair mobility, pre-gait, gait, advanced gait, and community mobility. The data was analyzed in a descriptive statistical way. This included the length of the stay, number of days physical therapy was provided divided by the total length of stay, the amount of sessions per day each patient had, and if it was one-on-one care with the patient and clinician, or if it was multiple patients with a single clinician that day. Here are some results that were found in this study. Out of 972 patients, 21,192 inpatient physical therapy sessions were performed. The mean length of stay was 18.7 days, where 13.6 of those days each patient had therapy. Each patient had therapy for about 1.5 sessions a day, where each session lasted about 38 minutes. Most frequent activities used by clinicians were gait training, pre-functional activities, and transfer training. Gait training included balance, postural awareness, motor learning, which included ankle-foot orthotics, using a cane, walker, and many other devices. Transfer training included relocating the body from one surface to another. For pre-functional activities included bed mobility, sitting, sitting to standing, and gait. Also, 84% of patients and families received educational intervention while they were in the inpatient facility. Here are two charts of the data analyzed that I had just spoke about in the results. While this was a great study, there were some limitations of the study. First was that some definitions thought of by therapists during the train-the-trainer session were very broad. Second, information on specific impairments of the patients were not given to the project team. So all we know in the study were that patients had a stroke on one side or both, but we do not really know what type of limitations the patients did have. And finally, the reliability of the data collection within the providers could be questioned, as providers gave the data to the project team from their own site. So during the data collection, providers could have changed information from sessions to make their session look like it was more productive, or to make their facility look better. So how does this pertain to us as physical therapy assistants? This shows that we need to treat our patients that come in that day and not their pathology. Take a few seconds in the beginning of your session to examine and evaluate your patient. Ask them how they felt after last session and if they have any concerns before beginning. It also shows that functional activities are more important to the patient, as to their main goal is usually to get back to what they were doing before they had their stroke or their pathology. And finally, we don't only need to educate the patient, but we also need to educate their family and or caregivers on what is going on during their sessions, and also what they can do at home to help their pathology and to help them get better in the fastest way possible. Thank you for listening to my presentation today. I hope it helped. Here's some contact information for myself if you have any questions about my presentation.